So saludos everyone. Thanks again for making it to the 8th meeting of the COVID-19 Recovery Task Force. I just wanted to share some housekeeping notes for tonight, usual spiel, but first this meeting will include interpretation in Spanish and Vietnamese. So gracias and welcome to our interpreters for today. We have Rosario, Carolina, Kui, and Fawn An. So for those of you who want to access the interpretation in Spanish or Vietnamese, click on the interpretation button on your Zoom screen and then select the appropriate language. In addition, for all of you, the interpretation is set to off. So if you want to hear this meeting in English, we recommend that you go to the interpretation icon on the bottom of your Zoom screen and click on English, so you can make sure you hear this presentation in English. So we have two videos, one in Spanish and another in Vietnamese that will play right now. Okay, Aurelia, you want to go to the, yes, thank you.
Hola y bienvenidos a esta reunión. Para acceder a la función de interpretación, haga clic en el icono del globo en la parte inferior de la ventana de Zoom y selecciona el idioma que desea. Para escuchar claramente el audio de interpretación, le recomendamos que también seleccione la opción para silenciar el audio original, que es la opción más baja en el menú después de hacer clic en el icono del globo.
Xin chào và cảm ơn quý vị đã tham dự buổi họp ngày hôm nay. Để truy cập vào phần thông dịch của ứng dụng Zoom, xin nhấn vào biểu tượng hình quả địa cầu ở phía dưới của màn hình và chọn ngôn ngữ theo ý muốn của quý vị. Để nghe rõ lời phiên dịch, chúng tôi khuyến khích quý vị chọn chức năng tắt âm thanh gốc nằm ở phía cuối trong phần tùy chọn của biểu tượng quả địa cầu.
So task force members, we ask all of you to rename yourselves on Zoom by first and last name, and to also add your organization name so we can ensure that you're identified as a task force member. All you have to do is click on the three little dots on the top right corner of your image and click on rename, and then you can go ahead and rename yourself. This meeting is open to the public. Saludos to all of you. Thank you so much for being here. You'll be able to see and hear tonight's meeting, and you will have the opportunity for 2 minutes time to share your voice and comments during the public comment portion of the meeting. That's going to happen towards the end of the agenda. Until then, we appreciate your patience and during the rest of the meeting. And then for task force members, as always, there will be time after each section of the agenda for questions. And we ask that if you do have a question during that time, to use the raise your hand feature down below on your Zoom screen. And then also when you introduce yourself, or before you speak, to also just share your name and your organization, just to make sure that this meeting is accessible to everyone. I will be the one announcing your name, so you can unmute yourself. I believe that's it for housekeeping. And I think we have Rosalind here on the line. Are you there, Rosalind?
I am. Thank you so much. Carlos, can you hear me?
Yes.
Great. So I'm going to apologize. I'm in a location that has quite a bit of background noise, so my apologies. But wanted to say good evening. Thank you so much for being here. And as usual, we like to always start our task force meetings acknowledging that we are on the ancestral lands of the Ohlone people, and we pay respect to their elders, past and present, and we give thanks to their sacrifice and examples of humility, stewardship, and resilience. And so with that, I think we're going to go right into reviewing our agenda for this evening. Thank you so much. So just real quickly, we will run through a few task force updates that we'd like to share with you all. And also if task force members have updates, we would like for you to share those. We'll have a presentation and an update on the community survey, an engagement toolkit, and we'll be looking for some action from our task force tonight on those items. And then we're really excited that we have two special presentations this evening by our own task force members, one from the Joint Venture Silicon Valley's Lighthouse initiative, and then a second presentation on diabetes, COVID-19, and community well-being. So we're really looking forward to those two presentations and a discussion. And as always, we will end our meeting with an opportunity for public comment and talk about next steps. Next slide. So just real briefly in terms of updates, we wanted to share with all of the task force members this evening. We do want to share that the steering committee meeting met on May 25th. They actually helped design the agenda for this evening's meeting. So we're very excited about the presentations that we're going to have this evening. In addition, the steering committee decided that we would cancel the July 14th task force meeting, and that will allow opportunity for all of the community engagement activities that are being planned actually this month, July and August, to occur. So we would have the opportunity to focus on those activities in July. Just an announcement about our August task force meeting. We are looking to actually hold that meeting at City Hall in our wing rooms. We are working to get final clarification on if that meeting can be held in a hybrid setting. So we will be sending additional information about that opportunity, but just wanted to let you know ahead of time that the August 11th meeting will at least be in person at City Hall and hopefully hybrid as well. In terms of the city's 2022-23 budget process, just wanted to share that the mayor's June budget message was released earlier this week, and the budget is on the city council agenda for next Tuesday for final adoption. And just also wanted to share, we shared this at last month's meeting, but the current budget proposal still does include the $2 million in American Rescue Plan funding set aside for the task force recommendations that the council is anticipating to come forward this fall. There is an additional allocation for $500,000 for the task force to use the promotores model in terms of our community outreach and engagement. And also there is an additional $200,000 allocation for our work on vaccinations and boosters and getting the word out to our communities. And so with that, we'll ask now if any of our task force members have any announcements to share with the group.
One quick announcement. Good evening, everyone. Just wanting to make sure that you all know that the Indian Health Center of Santa Clara Valley will be hosting a virtual gala on July 28th at 6:00 p.m. I would be happy to send out information to each and one of you so that you have it on your radar. Thank you.
Great, thank you so much for sharing. We'd be happy actually to send that information in an email to all of the task force members. Thank you so much. And Yvonne, I see your hand raised.
Thank you, Rosalind, and nice hair, by the way. Sorry, I had to say something about it. It's pretty. Good evening, everyone. I'm happy to share that Goodwill of Silicon Valley is going to be hosting a resource and job fair on July 21st from 9 a.m. to noon. So I will be sharing the flyer to be sent out. Thank you.
Great, thank you so much, Yvonne, for sharing. Any other announcements that any member would like to share? Okay, we'll be sure to send a follow-up email to everyone so you all have that information. All right, so at this point, Carlos, I think I'm turning it over to you for the next portion of the meeting.
Yes. Hello again, Carlos Velasquez, part of the Recovery Task Force team. So I'm happy to present to you this section of the agenda with Patty Diaz of Community Health Partnerships, who is a member and one of the chairs of our Community Engagement Committee. So yesterday, I believe a copy of the final draft of the Community Survey and Engagement Toolkit were distributed via email to all task force members. These documents were reviewed by the Community Engagement Committee at their meeting last week, and they recommend that it be approved by the task force tonight. Next slide, please. Here again are the community engagement strategies of the plan, of the community engagement plan of the task force, which again is how we will be connecting with the community to gather the input needed to support the task force's recommendations. The community survey and engagement toolkit are key parts of this plan. Next slide. So before I hand it off to Patty, I wanted to share a little bit about the process that we went through last month to make sure you all had the opportunity to provide input in completing these documents. So after introducing the survey and toolkit as part of our community engagement plan at our April task force meeting, we did ask committees to discuss in their upcoming meetings to provide us with some input to discuss what approaches in designing the survey we should incorporate and what types of input the committees would be interested in having us gather or questions to ask. We also did discuss these topics with members of the task force who volunteered to be part of an ad hoc meeting on May 5th. So we talked about it at the April task force meeting, and we had several task force members who raised their hand and said they were interested in giving us some input. So we had a great meeting with them in early May. So we took this input that we received from the committees and from this ad hoc committee to develop drafts of the survey and toolkit that we then shared with the Community Engagement Committee a couple of weeks ago. So they reviewed it and did some further refinement. We also shared with each committee the draft questions that were in the toolkit that related to their committee's topic. We wanted to make sure that you all had the opportunity to review it and provide some input. So this feedback led to a final draft that was then reviewed last week by the Community Engagement Committee, who voted to recommend their approval by the task force in our meeting tonight, as I said. So once approved, we will be finalizing and sharing with you by the end of next week the final versions of the survey and toolkit, so you can then begin sharing the survey to your communities or to use the toolkit to guide or support any existing or possible events, meeting discussions, or focus groups that you all will have this summer. In September, you will be receiving an analysis and review of what we heard from residents in the survey and these community events to inform and finalize your recommendations. So I think that's a little bit of an overview of the process that we went through, and I think maybe the next slide, I'll hand it off to Patty.
Thank you, Carlos. Can you hear me?
Yes.
Great, thank you. So we wanted to take some time to share some of the highlights of the survey that reflects some of the input that we received from the task force members and committees. So one of the things we heard that is we wanted to make sure that this is a short and simple survey. So the survey has 9 general questions. 6 of those questions are multiple choice questions, and 3 of them are open-ended questions. And then there are 7 easy to answer demographic questions. So the survey should take, based on those questions, it should take about 5 to 10 minutes to complete. And because of the limited amount of questions, the questions were designed to be general, so the input could be applied to all the committees, all the topics and issues from the committees. One of the things we also heard was that we wanted to make sure that the survey was accessible. So it was designed at a 3rd grade reading level. Once approved, it will be translated to Spanish and Vietnamese. We will also provide it in print and online, which includes a QR code. So to make sure that we support our communities impacted by the pandemic and to also encourage them to complete the survey, we are providing some incentives for the first 100 who completes the survey. So they'll be receiving a $25 Target gift card. And we're also looking to see if we can also offer gift cards or other incentives like food tickets at any pop-up or community events where that's possible. So the goal is to complete 500 surveys by mid-August. And this is where we're coming to you, to the task force, where we need your support for that. So if the task force member or organization, if each of you could complete a minimum of 10 of the surveys, then we can easily exceed this goal. But also it will ensure that your community voice, your community is heard through this process. So that's our goal by mid-August. Next slide, please. So in addition to the survey, we also have the engagement toolkit. And so the engagement toolkit has some questions that go beyond the survey. They go deeper into specific topics and issues that reflect the committees. And this is something that we're hoping that you can integrate already on any outreach activities or community events that you're already doing. We're hoping that this information can be shared to us to provide input from the community. And what you'll also see in the toolkit is that it provides you some information on how to do your own community event, your house meeting, or your focus group. And we also wanted to make sure that there was information about existing recovery resources that's provided from the City of San José. So the community engagement, we believe that the survey and the engagement toolkits are really important and a way to support task force members to bring back feedback from your organization's community and supporters about how it is that the pandemic has greatly impacted them. Thus, where the Community Engagement Committee recommendation is that the task force approve the community survey and engagement toolkit tonight. And we'd welcome a motion to approve these documents. Thank you.
Motion move.
There was a motion from Sam. Thank you, Sam. Is there a second?
I would like to second it, Carlos. This is Dolores.
Thank you, Dolores. All right. So I think this is a moment where we can go ahead and take a vote among the task force members. So task force members, if you want to use the raise your hand feature for all those who also approve the adoption of this survey and toolkit. Give me a quick second. Okay, I think I see 21 participants with their hands raised. And as I understand it, we have 23 participants. Okay. All right, so that's.
Sorry, Carlos, one quick question, if possible. Is it okay for a quick question here?
Of course.
I was wondering if the toolkit itself will be translated into Spanish and Vietnamese, or I do see that the flyer will be that, but what about the engagement toolkit itself?
Good question. We are also planning on translating the toolkit into Spanish and Vietnamese. I think maybe what we were thinking was maybe some of the documents that were meant to be public facing, like talking points or flyers, would be definitely translated. But if there is a desire to have the entire toolkit translated into Vietnamese and Spanish, we can definitely do that easily. So.
Okay. I mean, I would approve and go forward with this. I mean, it seems like most of them have. I think my only concern was that, you know, maybe there are some groups that are groups that only speak Spanish, or they're meeting, you know, regularly, but maybe they're meeting in Vietnamese or whatever it may be, and wanting to make sure that those groups can also use the toolkit, because it's a very good toolkit. So I just wanted to put that out there as a possibility. If we can make sure that that happens, I would definitely.
We'll make sure that happens, Hugo. Thanks. We definitely want to make it accessible.
Appreciate it.
So yeah.
Thank you.
Okay, I'm sorry. So we do, I see, I lost count. I think we have 3, 6, 9, 12. I think some folks lowered their hand again. I'm sorry. If we can just, I want to make sure I have a proper count. I did see 23 hands raised, and Katarina, as I understand it, we have 25 members of the task force present with us tonight.
Correct, Carlos. 25 primary task force representatives present right now.
Okay.
So if there are alternate members who are representing your organization, if you could let us know, because we would need your vote. I'm just reminded of our parliamentary procedures for voting. And so since we have 55 members of the task force, a quorum would be 28 members. So first we need to establish that we have a quorum. And I'm hoping that we do.
I think I did see someone from the Vietnamese American Roundtable. Philip, are you here? I see you have your hand up as well. So
yes, I just joined. Thank you.
Okay, I'm sorry. I need to have another count again. How many hands we have raised? For some reason, I can't see how many hands we have raised. Okay, it's still 23. But
I think that we may have members who are on that may have their cameras off. And perhaps, Carlos, if we need maybe to come back to the vote. Yeah, we can certainly do that to make sure we're up at least to 28.
Okay, I do see Jose Rodriguez, Monique Yamamoto with us, who are task force members. And if we have 24 hands raised, we have, I think we might need to just go back to this in just a little bit. Is that okay, Rosalind?
I'm sorry, I missed that, Carlos.
I just said that I think we are waiting. We're about 1 or 2 members short of 28. So we can come back to this. It does look like, yeah.
Yeah, we can certainly come back and do the vote again, just to make sure that we can at least get to 28. That's fine.
Okay. Well, it looks like we'll move on to the next item. Thanks everyone for being involved and for all of your input and helping us shape the survey and toolkit. All right, so now that we have the toolkit and survey, at least the vote partially completed, I wanted to also, we can start beginning to get this out. So we have an ask of task force members tonight to help with 2 of our kickoff events. So city staff have coordinated to have a table at Viva Calle San Jose this coming Sunday, and at the Juneteenth in the Streets Festival next Saturday in South First Street in downtown San Jose. This is going to be an opportunity for us to engage with the community through our storytelling project and asking residents to share with us through a foam board posters and sticky notes to tell us how they have experienced the pandemic and what kinds of support would they like to see provided to the community as we recover from COVID-19. So we have 3 members of our lived experience group who are going to be helping us at these events to staff these tables and help us engage with residents, but they need some help. So we're in need of 2 volunteers for this Sunday one for the 10 a.m. to 12:30 p.m. shift, and then another for the 12:30 to 3 p.m. shift. Our table will be at the Bakesto Park Hub at Viva Calle San Jose. And then on next weekend for Juneteenth and the festival, we do have 3 shifts here that we're looking for volunteers as well. So I know folks probably might need a minute or two to see if they're available, but do we have maybe any volunteers within the task force who would like to raise their hands and help us out for this coming Sunday?
I think all of our hands are still up from the last vote.
Oh, wow. Okay. Wow, we have so many volunteers.
So this is Allie. I can help on the June 18th Saturday, probably either the 2:30 or the 5 p.m. shift. And if you need me to shoot me an email to confirm that, Carlos, I can. I already have another event on Sunday, unfortunately, so I can't assist with Viva Calle.
Thank you so much, Ali.
Hey, Carlos, this is Sam with SCIU USW.
Uh-huh.
I'll probably be able to do the June 18 from 12 to 2:30 p.m. So can I send you the email later today to, or tomorrow to confirm that?
Yes.
But put me down though. I think I should be able to make it.
Awesome. Thank you so much, Sam. Jose, I see your hand is up as well. Is that for this item? For Iván?
Sí, sí, quiero ser voluntario el domingo a la tarde.
Thank you, Jose. He's agreeing to volunteer for this Sunday in the afternoon. And Jose, para el tiempo de 2:30 hasta las 3.
Sí, por favor, a las 3, 3 o'clock.
Pues muchas gracias, José. Me comunicaré con usted mañana por teléfono o por correo electrónico para pasarle la información. So I'll be...
Correcto, así esperaré.
And Iván, I see your hand up.
Yeah, I'm able to volunteer at least for an hour on Sunday, June 12th, so from 10 to 11. If that's
Awesome.
okay, sorry. Okay.
We'll take that. Wow, I'm so happy. Thank you so much to Ali, Jose, Sam, and Iván for volunteering. I'll be following up with you tomorrow with all the details. Thank you so much. Gracias.
Carlos, put me down 10 to 11 also on Sunday.
Awesome. You all are the best. Thank you for making my Thursday night. All right, and then we have one more last bullet point on this item, and I'll let Patty take it away.
Thanks, Carlos. So as part of the community engagement plan and tactics, the committee had discussed about the task force hosting a large community event either in late July or early August. The purpose of this large event will be to highlight community resiliency and recovery. And what we are looking as far as the outcome at this event is to provide space to hear community members impacted by the pandemic, to build awareness and connect the community with services and resources available, and to inform the community about the city and task force members' engagement efforts of this work. We're thinking that the format will be of a panel and a resource fair. Panel topics and issues would be based on the topics of the committees that we have, or the issue committees, such as the community health and well-being, housing, childcare, service and hospitality workers, workers' safety, small business, and arts and culture. And as far as who would be part of the panel, we're looking into really highlighting community members, the lived experience group, and representatives from organizations. And so the Community Engagement Committee would take the lead in hosting this, but we can't do it alone. This is a big event. And so we're asking the task force members for their support. So we wanted to get, especially for the resource fair, because we see that that's going to be a big, that's going to entail a lot of coordination and logistics and outreach. And so we wanted to gauge and see if the task force members would be interested in supporting this effort.
Patty, what kind of support do you need? This is Dolores.
Yeah, no, great question. So helping with the coordination, helping with logistics, helping us identify a location, outreach so that people can attend, and then tabling your organization so you can provide information and resources to the community.
Hi, Patty, this is Monique with Work to Future. How many employers are you thinking?
Employers to speak, or organization?
For the job fair, like how big of a space do you need?
Yeah, so we're thinking more that this would be organizations that would provide information of their services to the community, so to connect them to those services.
So a resource fair.
Yes, the resource fair.
Okay. We might be able to host. I just have to check on the day. Sorry about that.
Thank you, Allie.
Yeah, thank you, Monique. We can follow up with you about this if there's and we'd love to get your assistance with this, with definitely securing a location. That would definitely be one.
So you send me the information, and this is Raimundo, and maybe I can get some of our staff to be there to provide I guess I'm assuming services or a table of services. Is that what you're looking for?
Yeah, well, go ahead, Patty.
No, I was just going to reply, yes, Raimundo, that's exactly what we're looking for. Thank you.
Okay, yeah. So send me just some information. See who I can get out there.
So Patty, this is Allie. I'll help coordinate. I've done several large resource fairs, so I know how to navigate through some of the city resources.
Great, thank you, Allie.
Yvonne, I see with your hand up. Sorry.
Oops. Yeah, I definitely would like to participate as an organization, have a table there. And once you have more, task of, what do you need help with? If you could share that with me, and then I could, be happy to see what else I could support you with.
Thank you so much, Yvonne. We'll definitely follow up with you. Gerardo, I see your hand up.
Yes, just please keep In-House Center of Santa Clara Valley in the loop. We'd love to be able to support as well.
Awesome. Thank you so much, Gerardo. Dolores?
Well, because Patty and I work together, I will certainly assist, and my whole staff will likely. And what we can do is have a whole section on healthcare, including, we can include Indian Health Center there and Gardner, etc. We may also be able to get some COVID tests from the county, and that kind of supplies. So we will definitely assist.
Yeah, we definitely would need some help with securing some resources to be able to provide to the community. So that's awesome.
Mm-hmm.
Thank you so much, Dolores. Annie, I see your hand up as well.
Yeah, just if you can put me on the list, I would love to be involved in whatever way I can. Probably mostly with outreach, spreading the word. But at some point, I would love to maybe have a one-on-one chat with you or whoever's organizing this effort. There might be some alignment with what we're trying to do with peace as well.
Awesome. Yeah, I think it seems like there's interest in among the task force members to be involved, and so I want to make sure that I allow Claudia to also share. But it looks maybe what we might do is for those who are interested in helping out, maybe we can organize a quick meeting or kind of a small little ad hoc to just kind of maybe all meet and kind of discuss what resources we might need and how all folks can kind of contribute. It seems like that's probably the next step. Claudia, I want to make sure you also have a chance to comment.
So I just want to say that I'm interested in participating, and I think it would be a good opportunity for resolution too, if anything for the outreach, but just keep me on the loop.
Awesome. We'll do that too, Claudia. Well, I wonder, since that there is a good amount of interest among task force members to help with supporting the community engagement committee as they plan this event. I think, from what I understand, we now have 28 members of the task force, and so perhaps we can maybe also welcome a vote to maybe kind of formally approve this this action of hosting, having the task force host an event as Patty described. What do
So
you think?
Carlos,
Go
yeah,
ahead.
what we might want to do, if we could have a combined motion perhaps, because I think we do have now 28 task force members. So the motion would be approval of the community survey, of the engagement toolkit, and agreement on hosting this large community engagement event in late July and August. So 3 parts to the motion. That would be great.
Do we need to make another motion, or the original motion, or do we need to make another one?
Yeah, since we didn't have enough members to actually take a vote on that first motion, we would need now a new motion, and I think we can combine all 3 elements into one motion now, if that's the desire of the task force.
All right. Well, that's fine. I will make a motion to move that forward.
And I will second it.
All right, so I'm assuming that everyone's hands are to approve this, unless they have any questions, and we'll take a vote one more time. Okay, I see 25 hands up. Thank you so much. All right, so let's, folks, lower your hand so we can go. So if we can have a, I think we still see Zoe and Raimundo. Just, if it's okay, unless you have a question, I'll lower your hands.
I thought I did.
Oh yeah, sorry about that.
I did
Okay,
lowered, right?
Yeah, yes, you're lower now. So let's take for those who do not approve of the motion to raise your hands. All right, and if we can have anybody that's abstaining, I guess, to raise your hand. All right, looks like we have approval of the motion. So thank you all so much. I think for the folks who voted, who commented that they were interested, I'll be following up with you. Otherwise, we can, if you are also interested in helping out, you can go ahead and send me an email, or send an email to the CERT task force email, which is certaskforce@sanjoseca.gov. But thank you all so much. I hope when we send out an email tomorrow with the list of community events that were shared, I'll also go ahead and put that out in case there's any other additional task force members who want to sit in on this ad hoc committee. But thank you all so much. I think we can go on to the next item in the agenda.
All right. Good evening, everyone. My name is Aurelia Bailey, and I am also part of the Recovery Task Force team with the City of San Jose. Tonight, we have 2 presentations, like Rosalind had mentioned earlier, that were organized per steering committee's recommendation. So the first one we're going to hear from, who is also a task force member, is the executive director, Quincy Phillips, from joint venture Silicon Valley Lighthouse Initiative. He's going to be talking about the regional efforts efforts, which some of you are already actually working with him on this or with them on this, such as Destination Home and Catholic Charities. Quincy will cover of how we as a task force members can assist their efforts. So I'm going to pass it on to Quincy.
All right, thank you, Aurelia, and thank you, task force members, and thank you, City of San Jose, for having the opportunity. And special shout out to the steering committee for putting me on stage. So never turn down this type of opportunity, especially in the place that we're in right now. So again, my name is Quincy Phillips. You can call me Q, especially because I spell it Q-U-E-N-C-Y. So my mama already made me a marketer and ready for this role as an opportunity as well. I also play a dual role as Chief Equity Officer at Joint Venture Silicon Valley, and I'll talk a little bit about that. But hopefully, as I was saying, a little bit of that, you were reading some of our welcome message in terms of who we now transformed to be, especially 10 months after my arrival and being the executive director. We really are looking at mining the gaps, really looking and creating a landscape for this region where we support one another, where we're collective, and we have and start a relationship-based ecosystem that includes employers, that includes many of you, and also our community and lived experience individuals. We have an overarching goal of being and creating family-sustaining wages and income for all. So we are putting this all in a nice little Jedi frame of justice, equity, diversity, and inclusion. So this is our welcome. Welcome to a little bit of the Lighthouse show. Next slide, please. What we do, I think this might have some movement in it as well. As you can see, fancy new logo. Bridge to Recovery has been our foundation. And even within that, we provide leadership around these areas that you see. Coordination, especially around convening, is where we started, but we have now evolved to being more strategic thought partners, as well as we think through fund and resource development for all. So we're looking at collective ask, we're looking at being very targeted and very strategic as we aim to disrupt the systems that we know are keeping so many of us in this region below self-sustainability and self-sufficiency. I think it might be another little bullet there too. Sorry for the transitions. And as we do that, we started our foundation doing convening and facilitation, the Bridge to Recovery Network. I'll end up getting a little bit more into that in the next slide, and also recovery coordination. And we convene on a monthly basis, many members across both Santa Clara County and San Mateo County that are doing recovery efforts. We are looking beyond that now, which takes me to, our next slide. Established, as we say, in 2020, the Bridge to Recovery Network really started at Catholic Charities. So some of you may be familiar with that, but around July of last year, it transitioned to joint venture as the fiscal sponsor. And then underneath that, the Lighthouse initiative became what you see now. Our statement of purpose is our network unites to place every individual and family on the path to economic freedom. Point blank, period. We all should have an opportunity to thrive here in this region, especially when we put in the work. A few more transitions on this. We have over 125 stakeholders. We're growing, we're expanding. We also, that consists of 70 organizations, some of you that are included. We have 7 established partnerships, which right now is the way that we're able to maneuver and accomplish some of the things that you'll see throughout. Some of those partnerships are Stanford Impact Labs, Metro Ed, School District in the Silicon Valley Career Technical Education Center and Campus in San Jose. We also have Foothill and De Anza as a strategic partner where we're doing our workforce education and development. And then a few others. Adobe has just joined in on the fund. So we're bringing employers in on this as well. We have 3 active strategic initiatives actually in progress. Next slide, please. That being said, the name is changing. Bridge to Recovery is something that we're transitioning out of, and Lighthouse will actually encompass the network and everything that we do. So we will be sunsetting Bridge to Recovery. Obviously, when I took this role, it was not about recovery. It was about equity. It was about justice, equity, diversity, inclusion. It was about getting us beyond where we already knew we were, which was not being able to live and be able to thrive in this region. So now at Lighthouse, there are going to be so much marketing and things beyond that. You have beacons, you have lights, you have the ability to provide awareness to whether they're barriers, but also show folks when we and where we need resources, and also spotlighting some of our most vulnerable populations. So you'll see a lot of this transition and happening in the coming months. And then definitely by the fall, you'll see us distancing ourselves from Bridge to Recovery and actually just being Lighthouse. Next slide, please. Now to the work that we've been able to do in the last 10 months. For those of you that are not familiar, we really work across safety net and workforce development. And we have been convening for, again, since 2020. But as we came together, it was very obvious that we needed to reduce the silos. While we know there's a lot of work happening on the safety net side, we also know that there's a lot happening on workforce. That no wrong door policy that we aim to have, it does actually still happen here. I was a child that came up from a system, Section 8, food, first of the month, all of those programs. And I know my parents spent a lot of times in many different doors when, you know, especially now, we should be able to find or have a flag illuminate all that we need instead of having us walk through so many different doors. So some of our ability now is to reduce those pillars and those silos and bring them more into strategic initiatives that bring our network together, bring safety net in the same place as workforce development, but also adding to the pie, the employers across our region. Guaranteed basic income has been one of the things that has mobilized so many of us in this region, and we are now convening the larger state initiative, the $35 million state RFA, which really is looking like it's coming out in the first week of July. So be on the lookout. We just had a meeting with them today, and they spoke about it coming out on the last month of June. So we have a steering committee that's already working, partnerships with the county, partnerships with some of your organizations, Catholic Charities. Huge shout out to you all. Big shout out to Santa Clara County. Big shout out to the City of San Jose, Destination Home, Sunnyvale Community Services, First Five, and even Somos Mayfair and the Cise Puede Collective. So we are working as a regional convener, but we're also looking beyond. So while the state RFA is really focused on foster care youth and pregnant individuals, it does give us a path to think about the other populations that we truly need to serve and where guaranteed basic income would help. So we are convening. We'll have an additional call to action in the coming weeks, especially as the state releases this. One of the main things that Lighthouse is responsible for is a $5 million plus raise so that we have the private funding necessary to keep our most vulnerable populations having all of the resources instead of losing resources by having this quote unquote added benefit. So it's one of the initiatives that I hope to find partnership later with all of you. Adult Education 2.0 is our next initiative that we're focused on, and it's really around skills and job placement. This is where we see our employer engagement. This is where we most recently at Metro Ed had a JEDI partnership breakfast that brought together members of the city, members of our county, employers, workforce, Goodwill was there, and so many others as we look to bring more instructors and funding so that we can remove some of the barriers and create the right type of ecosystem so that those who are aiming to go through higher education, as well as being placed into above minimum wage and really self-sufficiency opportunities. That's what we're focused on in this initiative. Finally, community well-being is the last thing. And as we talk about ecosystem, we're not just talking about a job. We're not just talking about certain resources. Really, we're looking at and providing a mirror to those in this region who have created an ecosystem for themselves and their family. So I'm looking at tech, where we know I used to work in that Google space. We had transportation, we had food, we had a lot of great benefits. We had a lot. We knew that just the job alone and the pay and the income was not enough to keep us able to do the things that we needed to do with our families. So we're really looking at borrowing from some of the things that already exist, lessons learned, using data and research and metrics to really push us forward. So this rest of this is going to breeze through really quickly, and then I'll be in for a Q&A. So next slide, please. This is the shout out for you all. When we talk about guaranteed basic income, I really want to shout out some of you. Destination Home, Cisse Puede Collective, Sacred Heart, you all have been leading one that's actually going right now. We're in partnership with Catholic Charities and a number of others, and we're mirroring some of the lessons learned that you brought to our attention. So really big shout out to the members that are here. And for those that aren't here and that will watch our recording, I really appreciate the work that you have started. And we're here to continue to carry the load and bring more resources to what you've already begun. Next slide, please. We talk about the ecosystem. We talk about guaranteed basic income. We talk about no wrong doors. When we look at the Cisse Puede Collective and Destination Home, these are some of the partners that they needed to bring in to make sure that all of our populations had that area to go to, and that there was not a gap that they would fall into because of something that we missed. So we see an ecosystem like this. This is something that we're also developing within Lighthouse. So our current GBI initiative and the larger adult educations and the community well-being things that you hear me talk about, we're really thinking about a similar ecosystem that has been demonstrated here and has been demonstrated in Chicago and so many other places. We're at the table, we bring those resources here, and we then put those resources out to all of you. So be on the lookout for us to really get to the next slide, please. Have that call to action of how you all help us and how I see you all coming together with what is already happening with over 70 organizations and 125 stakeholders. Thinking about the regional initiative, we don't want to leave any of our family members behind. Are there populations that we should target that we're missing? We know, again, that foster care youth and pregnant individuals are the target, but are we thinking about seniors? Are we thinking about our youth in other areas? Please let us know who we should target, because again, we want to do a calculated ask, and an ask that's large enough for us all to have success. And then on the Adult Education 2.0, we're really, again, thinking about the barriers that need to be removed to support the folks that are closest. So one of the barriers are instructors. Right? There's a lot of funding that goes to our high school students when it comes to CTE. There are also things that happen at the K 14, 15, 16 levels. But when it comes to adult education, funding for things such as instructors fall by the wayside. Goodwill Silicon Valley has already raised their hand to bring funding to us to start to bring more pathways at night and on the weekend for some of these populations. We really just had 15 organization come at 8 to 10 a.m. earlier in this week who also pledged more. We'll have another breakfast coming up in next month, and then we'll plan some more during the fall. As we look at the convening and we're really looking at all of you, we really want to address the barriers and do it in a collective way. So at that point, I'm done with my presentation, and I'm open for any of the questions that you may have and hopefully the answers that I can provide. Thank you all for the time. Christine, your hand is raised first.
I'm on.
You're on, Christine. Oh, you're muted again, Christine.
You gotta love technology.
There we go. You're good.
All right. Hi, Quincy. Good to meet you, and thank you for the presentation. I'm really curious. I know that you highlighted some of the populations that you assist with and in your partner organizations. I'm wondering what you're doing to drill down on addressing issues around disability and supporting folks looking to get educated and either work in the workforce for a company or for themselves, doesn't matter. But the end goal being ending that poverty issue and reducing the need for financial supports like SSI, SSDI. Thanks.
No problem. Thank you for the question. One of the things that I'm blessed to have is a steering committee, and one of the members of our steering committee is Sharon Winston, who is the executive director for Project Hired. So this work, especially as we start to think about even adding the A to JEDI accessibility, we're in that portion. I would love to invite you into a conversation, especially having one of my steering committee members. There's an ongoing, as I said, in our strategic initiatives, there are ongoing working groups that when things bubble up to the point that we have the necessary support, we then highlight that as then being something. But we have something in the weeds with this that is working, but I would love to have another conversation and also bring Sharon Winston with us to have that
I would love
conversation.
to have that conversation with you. That was going to be my next question.
Yes,
Thank you,
I will
sir.
make sure that you get the email. Yes. Yvonne, Goodwill. Hey, I see Goodwill, and I appreciate you all as a original funding partner.
Thank you, Quincy, and I love your energy. It's you engage people, and I appreciate that. So thank you for that. My question is in regards to including individuals with disabilities, and also our seniors, that sometimes they're overlooked in initiatives like this one. The other thing is about not competitive wages necessarily, but livable wages for those individuals providing services to individuals with disabilities, seniors, childcare. So for individuals with disabilities would be like job coaches. Right now, more, the good side is that employers want to hire individuals with, I like to call them, with different abilities, not necessarily disabilities. But some organizations are having a hard time by having the staff necessary to provide those, job coaching services to individuals with different abilities. So maybe, and one of the reasons for that is that their wages are very low. Some other places are paying, higher wages. So if we could take that in consideration, that would be great. So thank you again.
Thank you. Thank you for that. That adds a, tally mark on this side in one of the ongoing conversations at our steering committee level. So thank you. All right.
Thank you, Quincy. Any other questions from the task force members? Okay, I think when we send out the notes, we'll make sure to include Quincy's information. Again, thank you so much for this presentation. As I mentioned early on, there's actually a second presentation tonight. So I'm going to hand it off to Carlos.
Thank you, Quincy.
I'm sorry, Derek, did you mention there was a question?
No, I just said thank you, Quincy.
Oh, yeah, thank you, Quincy. And Christine, I'll be sure to also connect you to Quincy. But yeah, as Aurelia mentioned, we will be sharing Quincy's email address in our email tomorrow for any folks who want to connect with him.
Thanks.
Thanks, Steve.
Yeah, so our final presentation for tonight is going to be one on diabetes, COVID-19, and community well-being. So a couple weeks ago, the steering committee agreed to invite task force members Dolores Alvarado, CEO of Community Health Partnerships, and Christus Cameron, Policy and Communications Associate with the Health Trust, to share a presentation on the prevalence of diabetes, the impact on our community as a whole, and its links to mortality rates among people with COVID-19. And also in light of the terrible incident in Uvalde, Texas, the committee also wished to highlight information on community well-being. So with that said, I wanted to invite Kayla Williams, a program coordinator with the Community Health Partnerships, to present on behalf of Dolores and Kristen. So hello, Kayla.
Hello, and thank you so much, Carlos. As Carlos mentioned, I'm a program coordinator at Community Health Partnership. And first and foremost, I'd like to thank the Health and Wellness Committee for granting me the opportunity to speak today. CHP and its member health centers have seen firsthand how the pandemic has exacerbated health disparities particularly among individuals with diabetes in our community, and especially in neighborhoods in San Jose with the highest rates of COVID. Next slide. Thank you. So today I'm going to give a brief intro of CHP, kind of set the landscape for both diabetes and COVID and that intersection within our community, talk a little bit about delays in care during the pandemic, and end with levels of prevention and recommendations for intervention in regards to diabetes. Next slide. So a little bit about CHP, Community Health Partnership. We're a consortium of member health centers in Santa Clara and San Mateo County. We span across 40 sites, serving 275,000 individuals. So some of the services our member health centers provide include primary care, behavioral health, community engagement, etc. Next slide. So a little bit about diabetes and prediabetes in our community. Among adults in Santa Clara County, 9% have been diagnosed with diabetes. Among adults served by the safety net, that range is between 8 to 13%. And when you're looking at adults in Santa Clara County, almost half of them have prediabetes. So within 5 years of diagnosis for those who have prediabetes, about a third of them will develop type 2 diabetes within that 5-year span. And then over the course of their lifetime, 70% of those individuals who are diagnosed with prediabetes will develop diabetes. Next slide, please. So as some of you may know, type 2 diabetes is a progressive disease. So upon diagnosis, oftentimes it gets worse over time. And so just listed below are some of the conditions that may happen if they're not managed properly. So stroke, blindness, liver disease, etc., with the worst being death. And we're going to talk a little bit about those health disparities later on as well. Next slide. So to prevent diabetes from getting worse, there is support. So individuals can take self-management classes, such as the ones offered by CHP and our member health centers. The ones that we're offering are culturally relevant, about physical activity, nutrition, and even mental health. They're also offered in a variety of languages, such as English and Spanish and Vietnamese. So the curriculum is evidence-based and there are proven health outcomes just within the cohort that CHP has been doing classes with. Over 60% have seen improvements in their A1C scores, which means their blood sugar is going down. And then a portion of them have also seen a reduction in their BMI, which means they're also losing weight after completion of the class as well. Next slide, please. So similar to diabetes and prediabetes, as we all know, COVID has also had a tremendous impact on our community. So the current positivity rate for Santa Clara County is about 8.6%. And then for the city of San Jose, it's at about 10.8%. And the positivity rate for San Jose is usually higher than the county. And when you're looking at countywide case rates, for 100,000 people, for the county, there's 18,405 that have had a positive test. And for citywide, per 100,000 people, approximately 19,000 have had that positive test. Next slide, please. There we go. So now I kind of want to further bridge that connection between diabetes, mental health, and COVID-19. So at the pandemic's beginning, stay-at-home orders were issued to stop the spread of COVID, which made sense. But unfortunately, this public health policy also negatively impacted a lot of people's mental health, and maybe some even on this call, because social isolation was really difficult to deal with. And something that we want to highlight is that those who are depressed have increased risk of diabetes, and those who have diabetes have increased risk of depression. So it can be a really vicious cycle. Fortunately, health centers, such as members of CHP's consortium, offer integrated behavioral health or mental health services to support those individuals who have feelings of depression or any other mental conditions or concerns as well. Next slide, please. So in addition to mental health, COVID-19 and diabetes, of course, affects physical health as well. So among individuals who are hospitalized for COVID and had diabetes, 25% of those did not survive, which is incredibly sad, and a significant portion had ended up in intensive care. And we could see those health disparities are not only for individuals who have diabetes, but those who just have like high or inconsistent glucose levels. So in previous slides, when I had said almost 50% of Santa Clara County has prediabetes and has been diagnosed for prediabetes, those are individuals with elevated glucose levels who are also at higher risk of hospitalization and death from COVID. Next slide, please. So this first graph here shows diabetes-related deaths within Santa Clara County in California. So among 100,000 residents, again, there are about 25 diabetes-related deaths. But when you look at the city of San Jose, those numbers are even higher. You can see it's 30, 40, it's incredibly high. So that shows that there's a specific health disparity in those zip codes for individuals who have diabetes. So they're dying at higher rates than those within the county as a whole and specifically within California. And then within those zip codes, again, those also have some of the highest COVID rates as well. So individuals in those zip codes are dually at risk for both COVID infection as well as diabetes complications and death. Next slide, please. So in San Jose alone, over 1,500 people have died from COVID, and over half of those had some sort of chronic condition, such as diabetes and hypertension. Next slide, please. And this further relates to these previous numbers in regards to hospitalizations. So when you're looking at individuals who have been hospitalized for COVID, you can see that a significant portion of them have hypertension, diabetes, and other chronic conditions that exacerbate their symptoms and lead to intensive care and or death, depending on that situation, as mentioned previously. Next slide, please. So I've talked about physical health and mental health, but there is also a financial burden because of COVID as well. So individuals with diabetes face higher medical costs, and that was prior to COVID and has again been burdened even more because of the economic downturn. There's also just been broadened economic inequalities. So for example, those with diabetes had higher unemployment rates, and they dipped into their savings or even took out loans to pay for their diabetes care. And then lastly, a lot of individuals with diabetes self-rationed their supplies just to make sure that they can get through with what they could. Next slide, please. So rationing supplies and delaying care can have lifelong impacts on individuals, particularly those with chronic conditions. And there were multiple reasons for delayed care. At the early onset of the pandemic, a lot of health systems had to close their offices or reduce capacity due to the uncertain nature of the pandemic. And then there were also a lot of patients who chose not to go into their healthcare provider and seek care because of fear of exposure. And it's been noted that approximately 40% of US adults have avoided or delayed care because of COVID-19 concerns. Next slide, please. So I just want to say that this presentation is not all doom and gloom. There are prevention and management strategies when it comes to diabetes on an individual level, as well as looking at the broader community as well. Next slide. So first, I'm going to talk about primary care, since the majority of what CHP's work is with our member health centers. So there's a lot to do with like primary care. So signing up for health coverage, and if you already have it, making sure that you see your annual, you'll see your provider during your annual physical exam, and then talking to your provider about your diabetes risk factors. And that not only includes your lifestyle, but also your family history as well. And then knowing what tests you can ask for from your provider, as well as taking the prediabetes risk test, which is just free and online and anyone can do. Next slide. Next is lifestyle and environment, which we all are probably fairly familiar with. So losing weight and engaging in physical activity, eating healthier, so your fruits and your veggies, reducing smoking and drinking as well. And something that's really important to highlight that we've seen in evidence-based practices as well as within our own self-management classes is making sure you have that support group, whether it's family or friends or neighbors or even the self-management class that I previously talked about to support you and keep you accountable for your goals. Next slide. So to wrap up, there are also larger advocacy and policy recommendations in regards to diabetes prevention and management. The first is around community engagement, which is amazing that I'm talking to this group right here. So starting those conversations and with a diverse community to make sure all input is reflected in those findings. Supporting a culturally diverse A1C campaign, particularly among communities with the greatest health disparities. Investing in diabetes self-management programs that are evidence-based, can be provided in various languages, in person, via Zoom, phone calls, to definitely increase access to those programs. Investing in community education campaigns in those zip code areas that I previously talked about that have super high rates of both COVID and diabetes-related deaths. Next, a fat or sugar tax, and using those funds to subsidize healthy foods, particularly in those high needs communities as well. Another one is reducing licensing for unhealthy eating places in low income neighborhoods, and doing that in support of increasing access to healthy alternatives. Investing in safe, clean, walkable parks and playgrounds, which are not only used for children, but adults as well. So individuals can get that physical activity, which is really important. Next is restricting advertisements of unhealthy products. And that could also include a campaign to remove sugary snacks from children's eye levels, as well as just promoting community health centers in San Jose that offer a variety of primary care services, behavioral health, case management, etc., to anyone who needs care. Next slide, please. So I just would like to also thank CHP's member health centers for all of their work that they have done in informing these recommendations and providing us with some of the data as well as the patients who have participated in our chronic disease self-management classes. And if it's okay, when we do Q&A, could we go back to the policy and recommendation slide, please? So thank you so much for your time. I know it was a lot of slides and a limited amount of time, but Dolores, Chris, and I are here to answer any questions.
Thank you so much, Kayla. Yeah, Derek, go ahead.
Yes, thank you for your presentation. I'm curious about, we know that if people have diabetes, their immune system is already compromised, and so COVID makes things worse. But what is the situation with people who don't have insurance, the high cost of insulin? Is that factored into it in terms of, I noticed the zip codes that you had in there in terms of income level. If people don't have enough insulin or don't have the proper amount, trying to stretch it and so forth, does your study factor that into it? Or is that a separate study, or have you not, or is that not being looked at?
So, Mr. Derek,
Yes.
this is Dolores to answer your question. So what we just presented was not a study that we've conducted. It's presenting what we've known for many, many years around diabetes. And then COVID just made it worse.
Right.
So that came out. The issue around health coverage and insulin is a big issue. First, let me just say that in Santa Clara County, we're very fortunate. We have a coverage program for folks who do not qualify for Covered California or who are not here with workers' documents or workers' permits. So we do have a partnership with Santa Clara County Health Department, the VMC in particular, where folks do get care at our clinics and are able to use the hospital covered by a variety of resources. Insulin is a whole other story. There is quite a bit of legislation still pending about making insulin affordable and even free.
Yes,
So at this point, you know that, yeah. So that's been an issue, but we do have an opportunity to work with the county when we have patients who don't have Covered California or Blue Shield, Blue Cross, Anthem, etc. And I will tell you that Medi-Cal, and you guys probably all know this, is probably one of the best insurances on this earth. They're what they pay for and how easy it is to work with the health plans, Valley Health Plan, Santa Clara Family Health Plan, for the benefit of our low-income patients is really an honor in this county. And I don't think there are too many counties that have this opportunity. Our latest research, last answer to your question, has been in looking at the patients that we are serving currently in this 6-week class. So we are collecting a tremendous amount of data. We're also experimenting is not the right word. We're trying out telehealth. And we're about to get a little bit of help from the federal government to be able to buy internet access for our patients. The 6-week course, we ended up having to add another week to the course to teach people how to use Zoom. Many of our patients are monolingual, Spanish speaking, Chinese, Vietnamese, monolingual, all three. So that's where our research is right now, in how are people adjusting to using technology in order to help them change the behavior, and it's not about putting the blame on the patient, but changing the customs that we grew up with. So, long answer to your question. I hope it helped. Thank you.
Thank you. Thank you for your response.
You're very welcome.
Thank you, Derek. I see Yvonne with your hand up. Go ahead.
Thank you for that. First of all, I want to say, Caleb and Ms. Dolores, thank you so much for all this information. It's definitely very helpful. And I appreciate the policy recommendations that I wanted to ask. Are these something that is already in place or something that the community needs to advocate for?
This is something that we hope that the committee, many choices here takes on. Some of these are very, very difficult. And some are, low-hanging fruit.
Okay.
None of this is available as it is written here. We also did some research, meaning that we scanned what the rest of the country is doing, and that's where some of these ideas are coming from. We're about to launch an A1C campaign at a very small level. And the more I think about it, I think the campaign should be launched in those zip codes that Kayla highlighted before we go anywhere else outside of San Jose, perhaps include Gilroy, and that would be about it. Yeah.
Thank you again for all the great work that you're doing. And if there's anything that I could support with this, initiatives, please count me in. I appreciate that. And, oh, sorry, go ahead.
No, we will. Thank you, Yvonne.
Thank you. And would it be possible to get data on like the age group, the age groups of the individuals who have diabetes, especially in the city of San Jose?
We will do our best. If we talk to you offline, yeah, we will do our best.
Awesome.
It
Thank
just
you so
takes
much.
time, but yes.
Thank you.
Thank you, Yvonne. Sam, I see your hand up. Go ahead.
Yes, thank you, Kayla. That was beautiful presentation. I guess my question goes to you, Carlos. Can we have access to this document that they just present right now? I would like to share that with my members.
Yeah, so the full slides of this presentation are available on our COVID-19 Recovery Task Force webpage. So you can get a link to this this presentation, but I can also email you the presentation if that's okay, Dolores.
Of course.
So I can send you directly the presentation as well if you wish, Sam.
Yes.
Thank you.
Great. And Carrie.
Hi, Carlos. Hey, team. I just want to say thank you for this really important presentation and the opportunity to listen to your policy recommendations and your advocacy. So thank you for that. All types of diabetes are a major issue within our society. And I just wanted to ask you a little bit why you're focusing specifically on type 2 diabetes versus type 1 and type 2. So if you could just be a little bit more explicit about that, I'd really appreciate to hear your point of view. Thank you.
You know, the way that it's being categorized now, you are correct. They are dropping the 1 and the 2. So the science of it is moving into just the word diabetes and not categorizing one over the other. Most of the data that we have seen over the years was old in the sense that it had old papers to collect the data, so it would have a 2 next to it. But if you look at some of the new systems in the new medical journals, it's just calling it diabetes. You are correct.
Oh, okay, great. I was just pointing that out because some of the language in the presentation was very specific to type 2, which is in maybe the old thought process, kind of a different type of autoimmune disease. So I just wanted to bring that up because I feel like these policy recommendations could be a little bit more expanded to include just diabetes, as you mentioned, writ large. So anyways, I appreciate this. Thank you very much.
Very good point. Thank you. Really helpful. If anybody is at all interested in learning more and working with us on the A1C campaign, please let me know, or Patty, who's on the committee, who's going to be running it. Okay, I'm going to stop talking. I think there's more hands there, Carlos.
I don't know, Sam, did you have another question or, okay. Well, thank you so much, Dolores. Thank you so much, Kayla. Thank you so much, Kristen. I do appreciate these advocacy and policy recommendations. Just, I think it would be a good just reference for committees to review to see how if there's any connections that they might want to review in support of their own work. So again, this presentation is available on our recovery task force page, which I think we'll share the link to again in a few slides. But if anybody else is interested in getting the presentation, I can send it over.
Carlos, I neglected to mention that the work that we're doing around the classes, the actual classes to some of our patients, that has been heavily supported by the Health Trust because of their interest in diabetes. And they've had diabetes interest for, oh my God, as long as I've been working here, since 1996 or 7. So thank you to the Health Trust for that. So we're doing this in partnership with them.
Yeah, thank you so much, and thanks for highlighting the Health Trust. I know Q also highlighted a lot of the organizations that are working with them. Many of them are all here, are all within the task force. So it just is really inspirational.
Let's do some of that tech stuff. Let's get some agencies out of the barrio who are selling stuff that's very, very harmful to our gente. Get them out.
Thank you, Dolores.
Bye. Thank you.
All right. I believe, unless there's more questions, we'll get to the last section of our agenda, which is the public comment portion. And so again, if there are members of the public who wish to make a comment, go ahead and raise your hand, and we'll give you a couple minutes to make a comment. Well, it looks like we have one of our task force members who wants to make a comment. Go ahead, Monique.
Yes, I'm so sorry. Can I do an announcement here? Because I totally tried in the beginning and I couldn't get my hand up quick enough.
Sure.
I just wanted to mention to everyone that we have a job fair coming up on June 23rd at the Mexican Heritage Plaza from 11 to 1. That's it. Thank you.
Thank you so much, Monique. Any members of community, or I guess, Dolores, I see your hand up as well.
Well, I'm going to follow my predecessor's comments. I do have an announcement. The Community Health Partnership, in partnership with 4 of our clinics and 2 other CBOs, we are applying to HRSA for a grant to teach community health workers certain skills that need to be, taught in the field of healthcare. And we are looking for partners to be able to serve as either sites as an intern or to be able to hire the community health workers. We've had a couple of years as pilots with Mission College, and the application is going in partnership with Foothill Community College. They have an ability to what's the word, accreditate, it's accreditation process. So they're set for that. Come next year, community health clinics and other medical health providers will be able to bill for services provided by a community health worker. So that's the good news. The bad news is that the grant is due, the application is due on Tuesday. So at this point, we just want the partners. Would you be interested in considering being an agency that would take the community health workers as interns, as apprentices, or even hire them? And if so, if you could send Carlos an email, I guess, and then Carlos will let me know.
Yeah, I'll go ahead and share your email. It looks like we have a little bit of events and activities that we'll be sharing in our email tomorrow.
Okay,
follow
great.
up. So I can put your email address in there to the orders for people to
Thank
follow
you.
up with.
Thank you very much. Yes.
Thank you. All right, I see Raimundo with your hand up. Go ahead, Raimundo.
Can you see me? This is Raimundo.
Yes.
I just wanted to add this as one of the issues related to the COVID recovery. And that is that it's taken one of our, the Indian Health Center, 2 years to try to provide services to the homeless in a mobile unit. And I think we need to develop a policy or a way for people to be able to access the system, because I think staff is trying to implement the requirement that they know of, but it doesn't make sense for a provider who's trying to improve the human condition to have to wait 2 years, and we haven't even gotten it yet. She hasn't even gotten it yet. 2 years to get a special use permit to be able to provide services to on a mobile basis to the community, and including the unhoused, right? And so if there's anything we learned from the pandemic, is that it was really important to address the issues with the most vulnerable, and the most vulnerable are the unhoused. And yet it's taken 2 years for this person, and hasn't even been able to yet, to go out there and provide services to connect them, to provide COVID testing or vaccinations, to try to connect them for food or try to connect them to housing. And I think we just need to have a streamlined way or a streamlined policy to allow providers to do that. And on top of that, it's costing them $17,000 so far. And what they're doing right now is that they're trying to get a special use permit only to be able to provide services on their site and not be mobile. Now, we approached the city council yesterday, and they're going to do that in addition to write a letter that says this does not apply, so that they can go mobile and provide services to the community. But the bigger issue is, in the time of crisis, and even beyond the time of crisis, I think we need some type of a policy that says, if we're dealing with services or programs that are to improve the human condition that I think go along with the city, which the city's trying to deal with the homeless population, then we should have a trigger that allows us to go and bypass folks, so that one, we don't have to pay $17,000 to get a special use permit. Two, so that we can begin to provide services as quickly as possible and not have to wait 2 years or more to be able to provide a service that is needed by everyone. So that's what I have to say. So I don't know if we can incorporate that in some way, but I think it's really critical that be done, because that's not good policy.
Thank you, Raimundo. I wonder if that's, I know you're on the Community Health and Wellness Committee, if that's a conversation that we can continue to have and see if that's something that the committee wishes to incorporate as part of the conversations. part of the recommendations, or maybe even possibly some of the conversations that we have within the community this summer?
Yeah, the answer is yes, we would like to. You know, one good example that government did, which I never thought they would, is during the last 2 years, Medi-Cal waived the need to have people reapply for Medi-Cal. They just automatically re-enrolled them so that there would be no break in service. That's the kind of stuff that I think Raimundo's talking about. If you can move that kind of a mountain, imagine having to move Medi-Cal. We can certainly move something locally. So thank you.
Yeah, thank you.
Thank you, Raimundo. Thank you, Dolores. All right, I guess this was public comment, but it was task force members are making comments. So just, I don't see it. I don't imagine there are other members of the public who wish to comment. So I think we are ready to go on to the next section, which I think is next steps. Is that right, Aurelia? There's a slide, one more slide. Did you want to take us away, Rosalind?
Sure. So first, I just want to thank everyone for your participation this evening. Really just very thankful for the presentations, both from Q and from Kayla. A lot of good information sharing. A lot of things I learned actually tonight as well. But the one thing I do want to comment on in both presentations and even in the comments from the task force members this evening, it's like this work that we all are doing together, it's about partnerships. It's about everybody working together. And that's just kind of like a resounding theme that I definitely heard in both presentations. So again, just many thanks to all of you who are in this space, who are lifting up the work, lifting up the needs, bringing issues even to city government, holding us accountable. And I'm just so very thankful that we get to work together with you. And so with that, I think really the only announcement is just a reminder that the next full task force meeting will be held on August 11th. We will definitely be communicating with you about location and the opportunity for a hybrid meeting. And before that time, just remember we have several community engagement activities that are being held. And so we're going to be sure to like post a calendar on our recovery webpage so people can just access that to be kept up to date on all of the engagement activities. And so with that, again, just thank you so much for your participation this evening and have a good night. Good to see everyone again.
Thank you.
Thank you, everyone. Buenas noches.
Good night.
Thank you, Rosalind. Thank you.